About a decade back, we would see 10 to 11 million cancer cases per year, and WHO projections are that it will rise to 20 million in the next decade. Lifestyle issue that causes cancer or predisposes us to cancer is obesity. Hello everyone. My name is Anil D'Cruz. I'm a head and neck cancer surgeon. I'm also director of oncology at the Apollo Group of Hospitals. Today I'm going to tell you all something about cancer. And why should we know this about cancer? The incidence of cancer is rising. It's rising in the world. It's rising in our country. About a decade back, we would see 10 to 11 million cancer cases per year. The number has jumped to 14 million, and WHO projections are that it will rise to 20 million in the next decade. Why is this so? There are mainly two reasons. The first, we have started living longer. The average lifespan of an Indian is now about 70 years. The longer you live, higher incidence of getting cancer. What causes this when you live longer? It's our lifestyle. As we have a more affluent lifestyle, our middle class is growing, we see a higher incidence of cancer. Now, what are factors in our lifestyle that cause cancer or predispose us to cancer? Predominantly three. The first are habits, tobacco and alcohol. Both carcinogens, high incidence of cancer. About 40% of cancers in our country are caused because of tobacco. The second, infections, hepatitis, human papilloma virus, HIV, all these predispose to cancers. About 10% of our cancers are viral or infectious related. Cervical cancer used to be the number one cancer in women in our country and still is number two, caused predominantly by the human papilloma virus, which is transmitted because of poor genital hygiene, multiple partners and unprotected sex. And the third lifestyle issue that causes cancer or predisposes us to cancer is obesity. People who are more in weight for their height and age are more prone to get these cancers. Women who are obese are prone to 6 or at a higher risk of 6 cancers in their body. Commonest among them is breast and uterine cancer. Now, of all cancers in our country, the commonest are breast in female and cervical cancers, both in females, lung cancers, and mouth and tongue cancers. About a third of all cancers in our country are known as head and neck cancers, and mouth cancers or tongue cancers are part of head and neck. What is the head and neck? It's the region that starts from just below your brain all the way to your collarbone, and there are about 13 or 14 subsites within the head and neck region that can get cancers. The main reason why this is so common is because of tobacco use in our country. About a third of our countrymen above the age of 15 are predisposed or use tobacco in some form of the other. More than 50% use it in the smokeless form and about 30-40% in the smoked form. Any form of tobacco consumption predisposes you to a head and neck cancer. The risk is potentiated amongst those that have both habits, tobacco and alcohol. In the head and neck, there are two other cancers which are fairly common. Thyroid, the incidence is increasing, which is unrelated to tobacco, and salivary gland tumors, which also come under the realm of the head and neck surgeon. What are the warning signs of these cancers? Any patch or color discoloration in the mouth is a warning sign of an oral cancer. If you have a growth, an ulcer, loosening of your teeth, all a sign of oral cancer. As the head and neck subside goes back or above, if it affects the nasal cavities or the sinuses, you will have stuffiness of your nose. You will have bleeding from your nose. These symptoms, if they are cancer related, are usually unilateral on one side of the nose. If it's because of congestion, sinusitis, it's usually both sides. If it's a cancer at the back of the throat, you'll feel a foreign body sensation, difficulty in swallowing, pain when swallowing, what we call odynophagia. If it affects the voice box, there will be a change in your voice. It's also important to know that cancer spreads, and it spreads to the lymph glands of the neck. So sometimes cancer manifests with a small primary inside which does not give symptoms and a lymph gland in the neck. These need to be evaluated, particularly if you are a tobacco alcohol user and these glands or symptoms persist for more than 4 weeks. Thyroid cancer usually manifests with a little lump in the front of the neck in the region of the thyroid, and salivary gland cancers manifest with swellings in the region of the major gland called the parotid or the submandibular or sublingual gland which lies below the jawline. Early diagnosis is imperative. We have over 90% success rate if you come in the early stage. And how do you come in the early stage? I've shared the warning signs with you. Just for completion, I'll repeat this again. Oral cancer is the commonest head and neck cancer subsite, and a color change in the mouth, usually it's white or reddish. Our normal lining is pink, loosening of teeth, an ulcer or a growth in the mouth. All these are signs of oral cancer.